My name is Erin Parsons, and I'm a director of compliance here. But I will also add that I was a dispenser in my previous life, so I am very excited to talk about what this means for dispensers in the next 90 days. It's still critical that we remember and reflect that this applies to you now. Yes, there are exemptions that are still out there for that package level requirement for this fall for regular dispensers and then next fall for our small dispensers, but the other requirements are in place today. It is also enforceable today. As we saw in the poll, and we have been hearing from across the industry, we are also hearing that dispensers are starting to get visited. It is critical that they are prepared. And the one that really got me fired up was that there is nothing in this for our patients. As a licensed pharmacist, patient safety is critical. We have to protect our patient safety, and that we have to remove that barrier from our minds as dispensers here. Okay, where are we today? Suppliers are ready. Now is the time. As a prior dispenser, I have been counting down to this day every time we have kicked the can down the road here with the DSCSA. Our upstream business partners, exemptions have passed and the suppliers are ready. Hopefully, you've been working very diligently behind the scenes to build out your SOPs and systems to support compliance and operations in your pharmacy. Now is the time to put those systems and SOPs into action and refine any areas of opportunity. As we could see early on with that poll as to what we've learned since yesterday's date, there's opportunities that are available. Leverage these next 90 days to work through those opportunities so that when your deadline comes, there is not that same influx of, oh my gosh, we're missing something happening on your end as a dispenser. So in the next 90 days, you really want to be focused on testing those processes you've built and refining your SOPs. If there's challenges, connect with your trading partners to ensure they're resolved. Training your teams. Change management takes time. What approach are you going to take across your organization? Depending on the size, that may look different. Have you identified some subject matter experts? If you're a very large dispenser, have you identified some super users at the different sites who may be the responsible parties? And how are you going to get them to become the champions for you to successfully manage this change across your organization? Are you prepared for inspections? Again, as Trish talked about, we're going to expect visits to move beyond education in the months ahead. While the focus has been there, it's going to transition to accountability. Specifically from the Board of Pharmacy standpoint, yes, they are responsible for regulating pharmacy practice, but they are also tasked with protecting and promoting the public health and safety of the citizens in their states. They are going to have to move towards accountability to protect the safety of those citizens. Make sure you're prepared. And lastly, stay informed. There is a lot happening, and that a lot of news is going to be coming out in the weeks and months ahead. Make sure that you continue to keep yourself involved and are listening for what is happening in the dispenser space, as well as with your trading partners and what's happening in your local board of pharmacy and state marketplace. Now, as we move beyond compliance, compliance is the ground floor to any dispenser operation. But once you've laid that groundwork to ensure your teams and processes are in place, where are you going to ride the elevator to? What is the value to that data you now have? And how can it be leveraged to drive business decisions, improve operations, and tackle pain points in your pharmacies? So LSPedia is ready to support its customers in solving some of these industry questions. Dispensers continue to look for ways to run efficient and compliant operations while providing excellent care to their patients. LSPedia actually worked with Rite Aid to run a study on how complying with DSCSA would impact their operations. At the time of the study, Rite Aid had about 1,300 stores and was concerned about the operational burden compliance would place on their teams. However, non-compliance was not an option. So how could they manage these additional asks while still delivering patient care? They accomplished this through a two-phase approach. First was getting up their headquarter command center and making sure those teams and systems were in place. Phase two was store implementation through OneScan Pharmacy Pro. Through this approach, teams were able to decrease their receiving time from several hours to approximately 90 minutes. With 90 minutes of time back, the operators can look to instead impact labor, leverage that time to increase patient care, and improve team well-being. There's more that can be done as you consider other potential pain points in the dispenser operating space, potentially tackling recalls, advanced inventory management, and digging through that data. I personally am very excited to see what's ahead.